Roughly 36 people rallied in front of UCSD Jacobs Medical Center to protest the cuts. UCSD Health last week laid off 200 workers across its clinics and hospitals. That's about 1.5% of its workforce. The cuts include many frontline workers.
When we are experiencing a staffing crisis already.
Nurse Michael Kennedy says it's the workers who make UCSD one of the best healthcare systems in the nation.
UCSD deserves its #1 status, they really do, but they deserve it because of us, because of these dedicated nurses out here.
Workers say the layoffs were abrupt. Candace Dangler got a text message while at the doctor's office,
requesting that I go into a Zoom meeting.
By the time the visit was over,
I had already been laid off. No one ever spoke to me.
UCSD says the layoffs were necessary due to rising costs, regulatory uncertainty, and federal funding cuts. In a statement, the healthcare system says the recent decision to lay off members of our team was very difficult, and we did not arrive at that decision lightly or quickly. The decision followed a rigorous and comprehensive staff benchmarking process that focused on safety and operational sustainability. While funding cuts to the UC are real, the union says those cuts should come from the top, not these frontline workers, because that affects patient care.
I've been getting reports that now patients have actually urinated in their bed, waiting for someone to come and help them as a result of not having enough staff.
They made no cuts at the top, I'll tell you that. They made no cuts at the top, they immediately went for the bottom. They gave themselves a pay raise a week after firing staff. That is unconscionable. That is unbelievable.
The union is asking that UCSD reinstate laid-off workers immediately. UCSD says it is working diligently to, quote, ensure patient safety while managing this difficult process. Alexander Nguyen, KPBS News.